If your office coffee is the highlight of your morning, it may come with a hidden risk: your heart health. A new study conducted by researchers at Uppsala University in Sweden raises significant concerns about the potential cardiovascular dangers associated with coffee brewed in workplace machines. The research reveals that office coffee, particularly when brewed with certain methods, can contain high levels of cafestol and caweol, two compounds that are known to elevate LDL cholesterol levels. These substances, found naturally in coffee beans, are not filtered out by all brewing methods and are particularly problematic in many commercial coffee machines used in office environments. This is alarming news for many, especially considering that coffee is one of the most widely consumed beverages worldwide, with workplace coffee machines serving as a primary source of caffeine for millions. While many are aware that coffee can have an impact on cholesterol levels, this new research highlights the specific dangers tied to the way coffee is brewed in office settings. The study, which analyzed coffee from 14 different workplace machines, found that the machines commonly used in office environments are not efficient at removing the harmful diterpenes, cafestol and caweol. These compounds are strongly linked to higher levels of LDL cholesterol, the bad cholesterol that contributes to plaque buildup in arteries and increases the risk of cardiovascular diseases, including heart attacks and strokes. The study also reveals that while paper filters, like those used in drip coffee makers, are effective in removing these harmful compounds, the metal filters used in many office coffee machines allow them to pass through. This means that if your office uses an espresso machine, percolator, or other metal filter-based systems, you could be drinking coffee that actively contributes to a higher cholesterol level. Worse still, the levels of cafestol and caweol can vary widely depending on the type of machine and the brand of coffee used, further complicating the issue. The researchers pointed out that many workers may be unknowingly increasing their cardiovascular risk by drinking coffee from machines that fail to adequately filter out these compounds. The long-term implications of this could be concerning, especially since many people consume multiple cups of coffee a day at work. Even moderate daily consumption of coffee brewed from these machines could significantly impact cholesterol levels over time. According to the study, a reduction of just 1 millimole per liter in LDL cholesterol can lower the relative risk of heart disease by 22%. When applied over the span of a typical 40-year career, this could translate to a staggering 54% reduction in heart disease risk, underscoring the importance of being mindful about coffee brewing methods. Despite coffee's many benefits, such as potential cancer protection, cognitive enhancement, and even weight loss support, this research serves as a stark reminder that it's not all positive news when it comes to your favorite morning pick-me-up. Coffee has long been celebrated for its ability to boost energy and even lower the risk of premature death when consumed in moderation, particularly when enjoyed as part of a healthy lifestyle. But this new study points to the fact that the way coffee is brewed, particularly in the workplace, could potentially nullify these benefits if the wrong brewing methods are used consistently. For people who drink coffee every day, especially those who rely on it to fuel their workday, the risks may not be immediately apparent. Unlike other more well-known cardiovascular risk factors like smoking or an unhealthy diet, the gradual accumulation of these compounds in your system due to office coffee consumption can fly under the radar. Many people may be unaware that their daily coffee habit could be quietly raising their cholesterol levels and placing them at greater risk of heart disease down the line. This study calls for a much-needed reassessment of how office coffee is prepared, urging workplaces to consider the health implications of their coffee-making practices. While it may seem trivial, the widespread use of coffee machines that don't filter out these harmful compounds could be contributing to an invisible public health issue. As we move forward, it would be wise for employees and employers alike to pay attention to how their coffee is brewed and whether healthier alternatives like paper-filtered coffee could be incorporated into the workplace. The bottom line is that while coffee may be a convenient and beloved part of our daily routine, it's important to remember that not all cups of coffee are created equal. The way your coffee is brewed matters, and in the case of office coffee machines, it could be putting your heart at risk. As with any aspect of health, prevention is key, and in this case, the easiest change may be swapping to paper-filtered coffee or opting for other brewing methods that help reduce the amount of cholesterol-raising compounds in your cup.